Everybody. It's been a long time. I thought I better, boy, do I look weird. Well, I guess when you're sick, you're not well. So I'm definitely not well, and I don't look well either, do I? Well, I never did look the best. Well, for a long time, especially after I lost my teeth. That makes it kind of disgusting, doesn't it? Well, I don't know how many of you know this or not, but I'm starting my battle with breast cancer. I have had 3 biopsies. I've seen 3 or 4 doctors. Haven't seen my family doctor, so I don't know if she even knows what's going on, but there's only one thing I want you to, well, maybe 2 things, maybe 3 if I keep thinking. You know me. Anyway, I'm in good spirits. I'm going to beat this, me and Jesus. There's us in Jesus. There is me in team. There's no I, but there's a me. Um, what I want you to do is share this video. Share it, share it, share it, like it, subscribe it, because I plan on doing a series. This is volume 1. This is my cancer diagnosis and my plan for surgery. That's all I know up to this point in time. I know you don't like to talk about it. You don't like to hear about it. You don't want to say the word cancer. Oh my. Well, I'm diabetic. Diabetes can kill you. It's responsible for more deaths than you are aware of. They do not play it up like they do cancer. And cancer can be deadly. There's no doubt about it. There are types that there's not a whole lot you can do. But on the other hand, there are many, many types that can be prevented. I have tried the prevention route. I had cancer, breast cancer, in the same breast in 2002. I had a lumpectomy. They removed the lump. They took lymph nodes from under my arm to test them for cancer. That's how they tell if it's spread, I guess. But the worst part of it was probably taking the lymph nodes out because I had staph infection in it twice. And the last time my husband was looking at it and dressing my wound under my arm, and he said, "There's something black in here." And it kind of festered and come to the top. I said, "Well, get the tweezers and some alcohol so it doesn't get infected and take it out." Here they had left a stitch in there. That's why I had got 2 infections. I didn't think that you could get an infection from a stitch because some of them dissolve, but I guess it depends on what type of thread they use for the stitch. But anyway, after that, I went through radiation. The radiation, they don't tell you any side effects or any long term side effects. Of course, they don't. But one thing I want to point out here, your doctor is working for you. You went to him, you picked him out specifically or was referred to him, Your insurance that you pay your premiums to, or the government, or however you are insured, is paying your doctor. Your doctor is employed by you. You have control. When they found out I needed surgery this time, they told me to go to the cancer center and they would give me options of where to go to my surgery. I was in and out of there in 10 minutes, including the time I sat in the waiting room, which I'm not even sure I got my butt in the chair till they took me back. The doctor comes in. He said the nurse will be in and give you options of where you can go for your surgery. At that point, he did not say lumpectomy, mastectomy, or tonsillectomy. He didn't say anything. So she came in with a card and an appointment for me to have my surgery in Wexford. Wexford. Now, my good, loving partner, I'm going to call her my partner in life, my best friend, she said, "You're not taking yourself to your surgery and driving yourself home." I am known for that. I'm a tough old girl. I don't ask for help. I try not to ask anybody for anything. She said, "It's not even open for discussion." I said, "Okay, fine. You're taking me and you're picking me up and taking me home." Okay. I said to her, "Why do I have to go to Wexford? This is me. I get panic attacks. I don't want to sit home and think about traveling clear to Wexford, be upset and nervous the whole way down, maybe be sick after my surgery on the way home." And she said she wouldn't drive in Wexford, but her husband would take us down. Well, I'm like, this is my choice. Why do I have to go there? So I called the surgeon that I originally went to and I said, I went to the cancer surgery and they told me I had to go to Wexford. She says, "You definitely do not have to go where you do not want to go. This is your decision. And don't be afraid to argue with your doctor or your nurse or anybody else, even your best friend. If your best friend says, well, it must be better for you to go to Wexford, say, well, possibly, but I'm going to find out why this is working out this way." So I called my surgeon and she said, "You have every right to go wherever you want to go." So I went back and, well, I called him on the phone. She said, "Absolutely." And my surgeon's nurse said, "If they give you any flack, you call us back because you do not have to go to Wexford for surgery if you don't want to. You can pick I can have any surgeon in the world if I wanted to. I mean, if I can afford to fly, fly there, but that's beyond the point. You know what I'm trying to say. So don't always do what they tell you to do." I called them back and she said, "There is a doctor." I said, "Can I go to Clarion or Seneca?" And either one is fine. I'm familiar with them. It's not a long trip. I don't know how many times I might have to go back pre-surgery or post-surgery or for treatments or whatever. I'm not going back and forth to Wexford or Pittsburgh or anywhere down there. She said, "There is a doctor that comes up from Butler and he does the surgery in Clarion." So I said, "Good. I want an appointment to see him." I went to see him and I fell in love with that man. He said, "You don't have to go to Wexford. You can go anywhere you want." I said, "That's right. And I don't have to do what the doctors tell me to do." He said, "You're absolutely right. And you are a breath of fresh air." He said patients think that they have to do what the doctor says, and he himself is a doctor. What he does is breast surgery. That is his forte. So that made me feel good to have a professional, and I know Butler is a very good hospital, so he has to be a very good surgeon. He's very likable. I told him, I said, I just love you. He said, well, you got a lot on your plate. He examined it and he said, it's bad. Get dressed and I'll be back in. And I'm sitting there like, it's bad? Nobody has told me that before. In fact, they even argued that there was nothing wrong with it. And I'm like, it hurts. The whole end of my breast feels like one huge lump. I saw the mammogram. The end of my breast on the mammogram was almost completely black. Two nurses saw me looking at it, and they both said at the same time, that's just dense tissue. And I'm thinking, dense tissue my ass. I've seen my mammograms from the past, and they were dense, they were gray, but not almost solid, and in one area, and the rest of it looked pretty clear. And there's something wrong with it. It hurts, it aches, and I'm not dropping it at this. So I went to a surgeon in Clarion, and she took a tissue sample, but it was not enough. It was not deep enough, and it came back benign. And the surgeon said that's because she didn't get enough of the tissue. She only took the outer skin. And they did another mammogram and they found a second lesion. The first lesion they found was benign. So I'm like, woohoo. Well, then I saw those x rays, those mammograms, and I'm like, no. And it hurts. And it's hard. So I went back and here there was a cyst. They didn't pick up on the first mammogram because it was hidden in all this dense tissue. Well, they finally found it. I had a biopsy on that and it was malignant. So if you know your body, don't let them tell you there's nothing wrong with you. Now I have to have the whole breast removed. And I'm not saying that I wouldn't have had if they would have listened to me in the beginning because it was bad then. But I got into an argument with the surgeon over politics. Don't argue with your surgeon over politics. You know me. I open my big mouth, and it's partly a joke and partly I was serious. But I joked to him and I said, don't do anything during the biopsy that might keep me from voting because I already voted by mail. And that was a joke. People that don't know me don't get my jokes. And some doctors have no sense of humor, and I think I'd already pissed them off saying I didn't like Trump, but so be it. I thought you got money. You don't need to give a shit what the economy is. Don't even go there with me. So anyway, he said, I treat all patients the same. And I thought, well, I hope you do. But he should have looked at that and seen, oops, I almost spilled my cup. Seen there was something wrong. I know I'm making a short story very long, but another thing, don't think that only women get breast cancer. Men, examine your breasts. It's a lot easier for you to find a lump than it is a woman, especially if you're a woman with larger breasts or if they have dense tissue. And to me, my breasts always feel like they're lumpy. So self-exams didn't work for me. I have a neighbor has not had a mammogram her whole life, and she's older than I am. And her mother died at a young age with some type of cancer. I don't know what it was. But I'm like, what is wrong with women? You can if you get it too late, you're going through radiation, you're going through chemo, you're going through radical surgery. Keep getting your mammograms every year. I don't give a shit what the doctor tells you. Go every year. I'm not sure what age they recommend getting the first one, but if you have a history of it in your family, my sister had it, my mother's two sisters had it. It runs in my family. That is a big concern. Also, since I had it before in the same breast, they do not do a lump. This is what the surgeon said, and this is probably how he does it. If you have had a lumpectomy in that breast before and it was cancerous, then the next step is a mastectomy. They do not mess around taking another lumpectomy or anything like that. He says, we just want it gone. And it's been 23 years since I had the other surgery. But with the way it feels now and with it aching, I don't want it there anymore. This is more serious than the first time. So I'm expecting treatments. I'm hoping not chemo. My dad did well with chemo, but not everybody does, and I don't want to lay around being sick and throwing up and all that. Radiation, they can burn you. It weakens your ribs. I've had several broken ribs since I had radiation on that side. They don't tell you. They did say they were glad it wasn't on the left because it can affect your heart. Well, what about my liver? My liver is on the right side. I had my gallbladder out. I'm not sure the radiation had anything to do with that because when I had it out, it was just full of sludge. It didn't really need to come out, but he said at some point it will. And with gastric bypass surgery, which I had, it affects your gallbladder. And at some point, your gallbladder is going to have to go. So I said, I'm here. I'm ready. Let's do this. So my gallbladder's gone. I've got a lot of things that are gone, but you can't see them. I had a hysterectomy. I had my thyroid out. I had a heel spur removed, but nobody can see that on the bottom of my foot. But this is the first thing I'm having removed that somebody, well, my teeth. This is the first appendage I've had removed. And people can't figure out why I joke about it. I had one breakdown, I think, and that was when I found out it was malignant, and I'm like, what do I do? Do I call somebody? I have no family that's close. I feel like I should call my mom. My mom died in 2001. I don't think she's going to pick up the phone. And I don't think she's got the same number. And I don't know how to dial heaven, which I hope she's up there. And if she's not, I don't know who is. So I went through all the testing, came back malignant, went to the doctor from Butler, the surgeon, and he said we could do this. This was on Wednesday. He said we could do the surgery on Monday. What do you think about that? And I'm like, yes, I said, yes, let's do it. He said, you are a breath of fresh air. He said, I have a woman has been coming and sitting in that chair, and he pointed to the chair beside me, for several months because she can't decide what she wants to have done. And I said, the cancer isn't just sitting in there, it's growing, it's going places. I'm not going to sit around for months to make a decision. I don't need it. I'm not going to breastfeed anybody or anything that I'm aware of. And it would be dry as a bone if I did. I'm tired of having two that aren't the same size anyway. My insurance will buy me a bra with a prosthetic built right in that I can wear probably easier than what I've been trying to do for the last 20 some years, getting a bra with two different cup sizes, taking padding out of one side, putting it in the other side, and hoping nobody notices. Well, do I care if they notice? I want them to know I'm a survivor. I've survived a lot of crap. And every night I pray, I'm to the point I can't do a whole lot to help people. And I'll probably start crying because I'm going to talk about Jesus a little bit, but don't you dare go away. You listen, you need to hear this because it is enlightenment. I'm not going to preach to you, I'm just going to tell you my own experience. About 2 years ago, I decided I was going to love myself. I got to get the phone. Maybe it's a telemarketer. If it is, woohoo! They hung up. I thought we'd have some fun. But anyway, where was I? Brain fog. Oh, here they are again. I'm going to let you listen this time. Hello. Yeah.